Hello, good afternoon. I am here at Bob Cares Clinic at Nodado General Hospital to learn more about guidance and counseling services, and we will be having Sir Bob Suarez for this interview.
Welcome, Jerry.
Sir,
Please
good
sit down.
afternoon.
Good afternoon. Yeah, you have traveled a lot, a longer time.
Yeah.
How's the trouble?
It's quite longer than expected.
Okay. You're here to ask some question about counseling profession?
Yes, please, sir. Shall we begin?
Yeah.
All right. My first question, sir, is what led you to your profession?
I'm a graduate of psychology, and then I studied some units in education, and I was exposed in guidance and counseling that time. So I also took units in guidance and counseling at UP. Then I studied nursing. That's why I used counseling as a therapy for my clients in a clinical setting.
All right. What is the personal qualification of a person providing professional counseling
In a clinical setting,
in your setting?
well, basically, you must have a background in medical profession. For example, we deal different types of patient, clients, and I need to be well-oriented on their cases. In this case, usually, the profession has to be prepared in one direction of clinical setup.
All right. Important skills to be a counselor.
Listening. One important aspect in listening is the ability of the person to just keep quiet, be with the patient or client, and just listen.
Okay. What is the advantage or disadvantage of being a counselor?
I consider it not disadvantage. It's always the way you see it. The profession is dealing in a relationship, helping the person to talk. And basically, when the person talks, you just have to listen. And then the advantage is that you learn a lot from the woes, from the anxiety of the person, depending on their cases or concerns or needs.
Alright. What are the preparations would the future counselor need to take in order to increase competencies in this field?
He has to continue study, attend conventions. In my case, I attend nursing conventions dealing with different types of cases in a clinical setting. For example, depression, drug addiction, sex addiction, different types.
Alright. As you mentioned that you are in a medical setting, what kind of counseling service that you do?
Well, it's really a helping relationship. We try to talk with the person and listen. After listening to the concerns, issues, needs, or problems of the client or patient, we try to provide them some list of options and then let the client decide.
Alright. What type of clients that you have?
Right now, majority are parents having some concerns to their children. Second, wives having concerns about their husband. And some are students wanting to learn about career.
Alright. As you are here in Nodado General Hospital, are there cases that doctors or professionals that come with you?
Yes, they refer cases. Sometimes they themselves, when they are stressed, or feeling very low or down, they come to me, talk about their concerns, issues about their patients, about their profession. I'm just here to just listen. And, well, basically, they're friends. So in a friendly relationship, sometimes they just bring me some goodies, some
Alright.
gifts or what. But they don't pay it anymore.
Right. Normally, what age group that consults you the most?
We have age bracket 18 to 21, those seeking career guidance. And then adult, young women, professional women, mothers of age. Some are geriatric clients, meaning these are the senior citizens having some concerns about what to do in their retirement.
What are their common concerns regarding?
Well, for the retirees, they wanted to be clarified about what options they have when they retire. Another concern for the wives, how they will be able to become more loving to their husbands. And then for the young adults, pertaining to the stress that they experience in their office.
Alright. In your case, what procedures that you do when conducting counseling?
The procedures would be basically they make an appointment, and then I agree to the appointment, and during the appointment they register, and we just talk first. The talk is an initial conference between the client or patient, depending on their needs, issues that they feel about that moment. And after that, we decide whether counseling is fit to our helping relationship, or I would offer another type of activity or treatment. Some people, for example, let's say those people who are overweight, they seek counseling about their being overweight. But later on, during our initial talk, they found out that they have a choice to be overweight. So they need not have the counseling anymore, but enroll to my yoga class because I conduct yoga class. So they realize that during our initial talk, we do not assert that that person approach us or seeking counseling will always be provided with counseling service. We will always try to have some clarifications whether counseling is fit or not. If counseling service is fit for our professional relationship, we decide how many sessions, what, when, and where to conduct the session. Usually it is conducted here at my office. I have a couch here. Sometimes we go out of the hospital. We go to the garden area and just talk there, and I listen. After that, we discuss the appointment, the schedule of the session.
Normally, how long does it take in each session?
It's a 1 hour session actually. After that 1 hour session, we try to discuss how long first. Usually the counseling takes 1 hour, but how long is the service will take?
Yeah.
So it will depend on the progress of the counseling. Usually it takes 3 to 5 sessions for some minor cases or problems. But sometimes it lasts about 10 sessions.
In that 10 sessions, how many months it will take?
Usually once a week.
Once a week. Alright.
Once a week.
In life, there are ups and downs. Whom do you see when you're down?
Me as a counselor?
Yeah.
Well, I learned that matter during my psychiatric nursing. When you try to provide professional help to clients or patients with anxieties or sometimes form of depression. As counselor, I learned that we need to do some self-awareness. We need to increase our self-awareness. And in that case, we try to keep distance to the self and then see ourselves from a distance in an objective way. So when I'm down, I have the feeling that I will be feeling down. And that's the time that I need to distance myself.
Alright.
Self-analyzing. But sometimes self-analyzing is not needed anymore or not appropriate. We need to see someone to talk to. So I have my significant others to talk to. I have also my other professional friends to just talk, and then they listen. And sometimes the depression that I feel or the anxiety that I receive from other clients as well, moment by moment is gone.
In your term of service, long term of your service, is there any instance that there is a client that you cannot handle?
Well, there will be some clients that, based on your evaluation of their concerns, it is not within your expertise.
And then how do you approach them?
Well, we just have to tell them that my qualifications will be like this, that I cannot handle your situation. I will refer you to some other professional.
Alright. And how sure are you that your recommendation fits your clients?
Well, I monitor. I follow up the concerns of the client. During the sessions, we always try to do some progressive feedbacking. And the feedback will determine whether the person is doing well with my recommendations. But usually, it's not really a recommendation. Just deciding, the counselor, we do not decide for them. We'll help them to decide for themselves. We just provide options.
What can you say about people who says that when a person approaches a counselor, they have a mental problem?
That's usually the case in the Philippine setting because we are not really that having the mindset of consulting a person, a professional for that matter, to deal with our anxiety. Practically, the people in our setting, we have several significant others to talk to, and that is one form of counseling. Now, going to the professional counselor is different. If they wanted to seek professional help, they have to go to the counselor with training, with expertise.
All right. For the closing, what will you advise to the students who want to pursue the counseling profession?
Well, as a student, I will try to encourage them to learn to be silent and just listen. That's it.
All right, sir. Thank you so much, sir, for your time.
Thank you very much, Jerry.
Thank you, sir.
Thank you for coming also, and good luck to your work.
All right, thank you.
Okay.
God bless.